Do you ever feel an overwhelming sense of nervousness or stress?
Yes.
Not just your typical butterflies you get before taking an exam or giving a speech, but a wave of dread sweeping through your body. If so, what you're experiencing may be more than just worry. What you're experiencing may be an anxiety disorder. I am qualified to inform you about anxiety disorders because I have experience with different types of these disorders. Having Having an anxiety disorder can add even more stress to the panic you're already feeling. But by first knowing what anxiety is, its symptoms, and how you can to treat it, you can control this disorder and hopefully get rid of it. First, what is an anxiety disorder and what type of disorders are there? According to the National Institute of Mental Health, anxiety disorders are found in over 40 million Americans over the age of 18, causing them to be overwhelmed with nervousness and fearfulness. Anxiety disorders can also last up to 6 months, and conditions may worsen if not treated earlier. People with anxiety disorders can fall into deep depression that can lead to alcohol and drug abuse to help ease the pain. Their relationship with family, friends, their jobs and schools can also be put at risk. There are 6 different types of anxiety disorders, which are panic disorders, phobias, obsessive compulsive disorder, post-traumatic stress disorder, and general anxiety disorder. Which leads me to my second point, the symptoms of each type of disorders. Mm-hmm. As stated before, there are many types of disorders and with different symptoms. According to the American Psychiatric Association, many symptoms of anxiety disorder include depression, tiredness, lack of sleep, and headaches. There are, like I said, there are 6 major types of anxiety disorders. Panic disorders are also known as panic attacks and can occur when a person feels an overwhelming sense of feeling of physical and psychological distress. A phobia is when a person is scared of something or like really scared of something, like a certain object or situation. There are 3 types of phobias: specific phobia, social phobia, and agoraphobia. Specific phobia is when you're specifically scared of something, like the fear of heights or fear of spiders. Social phobia is when you're fear of encountering social situations that might embarrass you, like speaking in public or meeting new people or using public facilities. Agoraphobia is when you're in a new place and you're scared that no one's going to help you and you have a panic attack or something. Obsessive compulsive disorder is when you're constantly obsessed with having a certain object in particular order, or becoming obsessive with recurring unwanted thoughts. People with OCD have repeated rituals that they have, such as repeatedly washing their hands or checking for things like if they lock their door or their lights are turned off, and how things are in a particular order. Post-traumatic stress disorder is PTSD. It happens after a person has gone through a traumatic event. They often have nightmares about the reoccurrence of the event, and they can hurt people along the way. people with PTSD may events that can cause PTSD might be people that came back from the military or people who have gone through physical or sexual abuse. Generalized anxiety disorder, also known as GAD, occurs when the person have a constant worry and fear of different events and situations going through their mind. It can affect their daily routine and also affect their job experience. Now that I have listed the symptoms of each different type of anxiety disorders, there are also many ways you can treat your disorder to lead a normal and controlled lifestyle. If you don't get treated, consequences will not only weigh heavily on yourself, but also your family and the people around you. As stated, James Gardner found that 15% of those suffering from depression will commit suicide if not treated. Anxiety disorders are probable causes to premature deaths and health risks such as strokes and cardiovascular diseases. Results from screening of patients with coronary artery disease showed that a reliable amount of patients also had anxiety disorders. Even though there are different treatments for each disorder, the most common way to treat patients are through medicine prescribed by your physician. Regrettably, many people do not realize that they have an anxiety disorder and continue their lives without seeking professional help. I hope through my research and explanation of what an anxiety disorder is, its symptoms, and its possible treatments, that you have gained enough basic knowledge to be aware of this disorder. If you feel that you might have this disorder, please seek professional help to gain more knowledge on how to deal with it. Don't let anxiety consume your life. Everyone deserves a happy and stress-free life. If you need help, ask. Yay!